Hello, welcome to the video on information regarding post dates or a post dates plan for when and if women go past their due date. So at this visit or time, we usually talk about this around the 39-week mark to help prepare families for what if people go past their guest date. And I always preface that that is so normal, that we know that average babies tend to come late. And so we anticipate that and really expect that that is a very normal thing. So at the birth center, your 40-week appointment is pretty, standard, but then at 41 weeks, we do a couple additional screens. One of them is called a non-stress test, or some would abbreviate NST. With this, all it means is you're gonna come into the birth center. We have a room upstairs that has an NST machine, and you will sit in the rocking chair, and a nurse or a midwife will put on 2 bands on your belly, one that monitors the baby's heartbeat, and the other one that monitors if you're having any contractions. We do this for about 20 to 40 minutes and look at baby's heartbeat over that period of time. Looking at that heartbeat gives us a lot of information about how your placenta is perfusing and giving baby the oxygen that it needs. If we deem that to be what's called a reactive NST or a normal non-stress test, then we know that your placenta is doing its job and providing baby with the oxygen that it needs with the current pregnancy. The other thing that we do at this point in pregnancy is called a biophysical profile, or a BPP. And that's an ultrasound that happens that looks at a few different things. One of those is the amniotic fluid level. We know that sometimes that can get less as the pregnancy goes on, so we like to check in on that. We also look at baby and a few different parts of baby, like movement and breathing pattern, and baby gets a score. And with that score, along with a non-stress test, that gives us reassurance that the pregnancy is doing well and that we can go forward. I tell people that it's really rare that something comes up on either one of these screens or tests that makes us feel that we need to do something sooner than that 42-week mark. But we do this in order to know that things are still going well and that we can continue on. So like I said, that usually happens right around that 41-week mark. At 41 and 4 days, we usually have women come back to the birth center and do a check-in to see how things are going. So what this means is we do a cervical exam to see what your cervix is at that point and whether or not we would recommend doing some cervical ripening. What does that mean? Well, cervical ripening here at the birth center often looks like trying to help your cervix get more ready for labor, because we know that if your cervix is a little bit more dilated or thinned out, or more, like I said, ready for labor, then other things that we can do to help bring labor on are more likely to succeed. So at the birth center, usually our option is something called a catheter. What a catheter does is that it's inserted through the vagina into the cervix, and there are 2 balloons. One of those balloons is on the inside of your cervix and the other one is on the outside. That is filled with water and then sandwiches your cervix to where that causes your cervix to kind of mechanically open up and dilate and thin out. And then oftentimes that balloon will then fall out when your cervix is about 3 to 5 centimeters dilated. Sometimes it doesn't fall out on its own, and we'll give you instructions with after 12 hours of being placed that you would take it out. And if that's the case, then we know that hopefully it's done some of that ripening to help get your body more ready for labor. There's something else called Dilapan that we can also use, that these are rods that are inserted into your cervix that do a similar thing by opening your cervix, and we would actually then take those out 24 hours after they're placed. But it is a little bit midwife discretion, or kind of depending on your cervical position, of which of those options we choose. So then on 41 and 5, which would be 41 weeks, 5 days, we usually recommend doing a castor oil smoothie that has been brought up by the American Association of Birth Centers that we use to help women's bodies get into labor if necessary. And we will go through this smoothie recipe with you and give you the ingredient list, and then you can go and pick that up. At 41 and 6, you can repeat this smoothie if it did not succeed in putting you into labor. We can do that the next day. And then we also potentially have the option for women to come in and have a cervical assessment to possibly break your water, if that would be an option to help bring people into labor. So there are many options that we have here at the birth center to try to get women into labor if necessary. I usually tell people that most of the time, it doesn't always take a lot to get your body into labor at this point, because we're getting closer to that 42-week mark where a lot of our bodies, if they haven't gone into labor already, are kind of on that verge. And so there are a lot of success stories with people doing these things and getting into labor without having to transfer out at 42 weeks. The question I always get is, when do we have to transfer? And for us, we need, good active labor at that 42-week, morning of that 42-week mark, to kind of be here at the birth center. And if not, then we will talk about transitioning to a hospital setting. But like I said, that happens very, very, very rarely. So we do have a lot of things in place to help. I went through a lot of information here on that video, but if you have further questions, do not hesitate to contact us. Feel free to call the nurse line anytime and we can talk more about that. Hope you're having a good day, and we'll talk to you soon. Thanks.